So prior, I did feel the different forms of tissue. Something is here. Is it a knot? No, it feels different than a knot. Is it adhesed? But since coming to Dr. Chris, hands-on, marking the actual sciatic, marking the piriformis, there's nothing like it. You have to come to a hands-on course. I've been able to treat my clients different, better. Same thing with the different techniques, and they've gotten better results. My name is Veronica Jaquez. I do sports rehab and massage therapy of Southern California. So I'm in Temecula, California. So this is my third year practicing. As I was practicing, I started off under a chiropractor, and I started feeling different forms of tissue on individuals. They were complaining about certain things. I would start asking the doctor, okay, what is this? It's different. Oh no, that's just scar tissue. I'm like, no, it's not. It does not feel like it's something different. I wanted to better help individuals and help relieve the pain. Started Googling things, and I happened to come across Dr. Chris Barefoot. Went down that rabbit hole and like, oh my gosh, yeah, this is what I was feeling. That gluey substance on that sciatic nerve of the lower back, and looked into the program, did an interview with him. It was scary initially because I told him, well, I'm just a massage therapist. He said, no, you're not just. This is, you came down the right path. You want to help people. So let's get started if you're willing to do this. And I did. I wanted to be the best I can be, as best as I could before I start treating officially. And clients started coming up like, hey, you have really good reviews. I'm having this. Can I see you? I would ask a few of the questions that Dr. Chris taught us. Like, oh, okay, he is a good candidate. Great, I have to start now. So I have to just get out of my comfort zone and officially start. So prior, I did feel the different forms of tissue. Like, okay, now what is this? Something is here. Is it a knot? No, it feels different than a knot. Okay, I do feel a little bit of inflammation, but since coming to Dr. Chris, hands-on, marking the actual sciatic, marking the piriformis, and him saying, okay, do you feel the tissue inflamed? Is it adhesed? I'm like, okay, what's an adhesion? And he explained more. I've already learned a little bit of that, but hands-on, there's nothing like it. You have to come to a hands-on course so you can start practicing better. I've been able to treat my clients different, better. Same thing with the different techniques, and they've gotten better results. Relief quicker and some longer term. The more I practice, it's been great. I still enjoy being able to help when they have tightness, like the lower back is super tight. I can loosen it up. Better so than other practitioners because of doing the adhesion release. So at the moment, I like to incorporate it with my practice. Down the line, we'll see if it's strictly adhesion release. We really learn with Dr. Chris and learning on this, like you really learn to pay attention to your client, get to the root cause of it, really listen to what they're telling you and what their pain that they're describing. A lot of what I'm getting is you're actually listening to me. Other people don't believe me. They just say, oh no, it's all in your head. It's not there. Truly listen to your patient / client to get to the root cause. It's been an amazing journey. Hopefully I can grow.
If you'd like to see more about how we fix chronic pain at Barefoot Rehab in New Jersey and with adhesion release methods across the world, hit the like, hit the subscribe, and stay tuned for more videos that we will be releasing each week.